Today's video on pain above the hips is brought to you by healthhype.com. This video does not replace the need for a medical consultation. Please speak to your doctor as soon as your symptoms arise. We all experience pain towards the sides of the abdomen at some point in time. Naturally, many of us would think that it is kidney pain. Women may also suspect that the pain is arising from the ovaries or fallopian tubes. However, there are many organs to consider when investigating the cause of pain above the hips. First, let's look at the exact location from an anatomical perspective. The abdomen can be broadly divided into 4 quadrants. With pain above the hips, it is the lower right quadrant and lower left quadrant that would need to be investigated. The hips refers to the joint where the thigh bone known as the femur articulates with the pelvic or hip bone. However, most of us tend to think of the hip as lying much higher, usually where we can feel the uppermost part of the pelvic bone. The area also correlates with the flanks, also referred to as the sides of the abdomen. Therefore, when looking at pain above the hips, it is also necessary to consider lower abdominal pain and flank pain. When investigating pain, it is important to first consider the organs that lie in the area of the pain. The main abdominal organ that lies in the area is the colon of the large intestine. This can be divided into the ascending colon, transverse colon, and descending colon, with the sigmoid colon tapering towards the rectum. Also occupying a large part of the abdominal cavity is the small intestine. The kidneys, which are often thought to be responsible for lower abdominal pain, are actually located much higher in the abdomen. It is tucked towards the back of the abdominal cavity. However, the tubes running from the kidneys down to the bladder in the pelvis may be one of the organs responsible for pain just above the hips. These tubes are known as the ureters. Let's look at some of the colon conditions that may cause pain above the hips. These conditions may include colitis, which is inflammation of the colon caused by many different mechanisms such as infections or an interruption in the blood supply to the colon. Irritable bowel syndrome, inflammatory bowel disease, diverticulitis, colon obstruction, and colorectal cancer. One of the relatively common conditions that is also a medical emergency involves the small pouch known as the appendix. When the appendix becomes blocked and infected, then it leads to appendicitis. This is a serious condition because the inflamed appendix can burst. The pain in appendicitis is felt approximately midway between the hip and belly button. It is usually severe and accompanied by other symptoms like nausea, vomiting, fever, and constipation or diarrhea. When pain above the hips are accompanied by urinary symptoms, like pain when urinating and frequent urination, then the ureters have to be considered as a possible cause. The 2 conditions of the ureters that are more likely to cause pain above the hips are urinary tract infections, which may spread upwards from the bladder to the ureters. Stones in the ureters, which are usually kidney stones that pass into the ureters. Women also need to consider gynecological causes of pain above the hips. Period pain is usually felt in the middle of the lower abdomen and pelvis. However, mid-cycle discomfort that is felt towards the sides may be due to ovulation. Some women experience ovulation pain, and this is also known as Mittelschmerz. Various problems involving the ovaries and fallopian tubes may cause pain towards the hips. This may include polycystic ovarian syndrome, endometriosis, and an ectopic pregnancy, among other possible gynecological conditions. Pain that is felt more towards the surface may be from the abdominal wall. This includes the skin, fat, muscles, tendons, ligaments and fascia that comprise the abdominal wall. Therefore, superficial pain above the hips may be due to soft tissue injuries, muscle strain, and hernias, among other conditions. Another possible cause is bone pain arising from the uppermost portions of the pelvic bone. Thank you for watching this video brought to you by healthhype.com. Visit our website for more information on pain above the hips. Please subscribe to our YouTube channel for updates on our latest medical videos.